Scoliosis is not uncommon these days. Scoliosis we see commonly in the young, and also we can see it in the elderly. A line about scoliosis, that if you were to look at any human being from the side, there are three curvatures, one for the neck, one for the chest, and one for the lower back. But if you were to look at a human being straight on, then it is a straight line. In a scoliotic individual, there is a curve that occurs like this, and a compensatory curve on the other side. This is referred to as scoliosis. We can see it in newborn children, we can see it in very young children. We can also see it more commonly in the age group of 9 to 12 years, which is what usually presents as idiopathic scoliosis in girls. Later on in age, as we get older, we can have degenerative scoliosis. Scoliosis can get corrected in the young and in the elderly by exercises, by braces to some extent. But if the deformity is severe, it would require surgery. During surgery, we put screws into the spine and correct the deformity so that the spine appears to be straight. All the time looking at the neurological status. If the neurological status is worsening, depending upon the somatosensory and evoked potentials, motor evoked potential, then we will stop the curvature at that level. A recent phenomenon that we see is in the elderly, because with age, there are certain deformities in the spine and the spine could get twisted. But in these individuals, if it causes neurological deficits, then surgery is recommended. One will have to look at these things more seriously in terms of screws not holding well, because in the elderly, osteoporosis is also a concern.